Okay, this video is about tirzepatide. The doses I'll talk about are tirzepatide doses, not semaglutide doses. So don't get them mixed up. In fact, hopefully you can see this. This is the little chart you get on your case, and the chart talks about tirzepatide, retatrutide, and semaglutide. And what I've done is put the S or R or T next to these doses. These are the common doses from the basic minimum dose. You know, the starter dose you should take for a week or two, and then the small dose on there, and then the medium, and then the large. So all of them are covered on here. So for tirzepatide, for the first dose, you want to have 2.5 milligrams, which is just here. So you look across and you'll note that that's 6 clicks. We'll come to that in a second. What's a click? After a week or two, you're feeling good, then you can move to 5 milligrams. So if you look for 5 on the list, you'll see T next to it, tirzepatide. And that needs 12 clicks. It means 120 milliliters. But you don't need to know the milliliters. You just need to know that there's 12 clicks for a small dose every week. And if you don't need to go from small to medium to large. What I suggest is you just give 1 extra click a week if you feel that you need it. And if you don't, then if you feel it's too much, too nauseous, something else not working, take a click off every week, or take it a day earlier or a day later. And you get to know the medicine and get to feel comfortable with it. Anyway, if we open the box, what you can see is this pen has been set up for a customer of mine. This is tirzepatide 120 milliliters, milligrams, sorry. And what you can see here is those clicks I'm doing are the clicks of the pen, and it goes up to 60. And all you need to do is look at the number of clicks you need and go to that number. 1, 2, 3, 4, 5, 6. There we go. That's a 6-click jobby. And so on up to, well, the highest dose of tirzepatide, at least recommended, is 37 clicks. So you go to 37 and push the button to inject. So let's look at the needle. Well, there isn't one. In fact, we're going to need to add the cartridge. This is the vial it came from, tirzepatide 120, and this is the bacteriostatic water, backwater, and that's mixed into this cartridge. So what we need to do is put the cartridge in the sleeve like this, yeah, and then lock it in place like so. What you also must do, and many people don't until they see the video like this, is you need to put a needle on now, because of where is the air going to go otherwise when you're getting this air out of your chamber, out of the cartridge. So you can see there's a couple of bubbles in there, which is fine. We just need to knock them to the top and then wind a couple on there and then press the button at the bottom. And as the bubble gets smaller, press less. So we need to take this top off as well. This is a 4mm tiny needle, which is used for diabetics, for insulin. And our job is just to get that to bubble with a bit of the medicine, and then we can know that there's no more air in there. So I'm going to do a couple more clicks, just 1 or 2 more clicks. There we go. A little bit have popped out there, and that means that there's no more air bubbles in there. Yeah, and now it's ready to go. So now you would put your 6 clicks on there. Yeah, 5, 6. And then just administer it into some fat. Okay, and press go, which is just press the end of the pen in And importantly, leave it in place for a few seconds later, maybe 10 seconds, because otherwise it might not get into your skin enough and you'll pull it out and it'll still be losing medicine. So yeah, just try and remember to do that. Otherwise, if you do too many like this, then that's okay. Just wind it back and it just releases, so you're not fixed or anything. When you're done, then put the little cover on, needle there, and I suggest you just take the needle off. Yeah, although this is a fresh needle, but I'll allow the customer to use a new needle that's sealed, and they'll also get a bag of needles like so. So there'll be enough for, even if you're taking small doses, there's 20 odd needles in there, so it should be plenty for your pen. And if you need more needles, then just give us a shout and I'll send you some more. Any more questions? Let me think. Yeah, remember to keep this in the fridge. If you're going traveling, then I suggest you get a little pack, something, you probably don't need that one, but something like this. It's called an insulin bag. And although it's not as fashionable as this plastic thing, it does keep it cool because there's as you can see, a freezer bag in there. And in fact, you can actually fit that in with the freezer bag, or you can take the pen out separately, and that just keeps you going for, especially during the summer when it's getting 35-40 degrees. This will keep the potency of the medicine more than warming it up for too long, and that's why we send it in a cool bag when we're delivering these things. All right, I hope I don't have to add any more to this video later, but I think that's all we need to talk about. Good luck, and thank you for shopping with Vietnam Compound Pharma.